flight to New York JFK.
Giulio Castagnata is flying to New York, and before he can board his flight, he has to prove that he's COVID-free.
You download the app on your phone, it has all your information.
This is AOKpass, a digital health passport that verifies whether someone has tested negative for the coronavirus or gotten inoculated. It's also known as a vaccine passport and meant to be easier to use and more reliable than paper immunization cards.
Medical results often are not even printed in a way that it's easy to interpret. Our system can verify health records.
Since the pandemic has devastated the travel industry, airports in Rome, Paris, and Singapore, as well as airlines like JetBlue and United, are experimenting with similar apps. They will compete for a slice of the global market for travel health services and certifications, which AOKpass estimates is worth nearly $20 billion. Travel industry experts say this type of digital health certificate could be a game changer, not just for tourism, but live events and schools. So here's how digital health passports work. Travelers who weren't able to take a COVID-19 test before departure at this airport in Rome can get swabbed at a testing site set up by the airport. While waiting for the result, passengers can download the AOKpass app and input their personal information like their birthday and email address. Within 30 minutes, the result is available. If the traveler tests negative, the app creates a unique QR code that serves as proof.
The doctor's scanning the QR code that says that you're negative and you're good to go.
At the airport in Rome, it has to be scanned at check-in and boarding.
I think this is the only way really right now to travel safely without risking contracting COVID.
Some, but not all airlines and governments require proof of a negative test before a passenger is allowed to board a flight or enter a country. While testing and vaccinations reduce the risk of spreading the virus, they don't eliminate it.
In the setting of COVID-19, health information is beginning to be used in a transactional sense, much more than before.
Chester Drum is a doctor at the National University Hospital in Singapore and co-founded AOKpass. He expects that in order for people to return to pre-pandemic life, they'll have to show proof of their health status.
Let me show you part of my medical record to get on an airplane. Let me show you that I've had a vaccination procedure in order to go to an event, for example.
This has also meant forgeries. For instance, last November, 7 people in Paris were arrested and charged with selling fake COVID-19 test results that cost as much as $360. Drum says the app fights counterfeiting using blockchain technology, so that the test result and vaccination certificates are unique and linked to only one individual.
The remarkable thing about blockchain is once it's entered, you can't change it.
While blockchain-backed apps may prevent fakes, there could be data leaks.
They pose a variety of essential questions for the protection of data privacy and human rights.
Anna Badusky is a researcher who studies the ethical implication of digital health data.
Policymakers should require digital health passport providers to adopt appropriate technical and organizational measures to address potential data privacy invasive situations proactively.
Public health researchers have found that some people in India and Indonesia who tested positive and had their results disclosed were verbally attacked or socially excluded. In the US, the Centers for Disease Control and Prevention recommends that community leaders and public health officials maintain the confidentiality of test results to avoid social stigma. AOKpass says it encrypts all personal health information and tries to keep to a minimum the data it collects on its users. The company also said it does not monetize data but has signed contracts with airports and airlines to develop and test the system. After nearly 10 months of testing, AOKpass is scheduled to launch in all major Italian and French airports by the end of February. It will have to compete with other companies developing a similar tool. United and JetBlue are preparing to use an app developed by the World Economic Forum called the Common Pass, while IBM is creating a digital health pass using blockchain. Drum says figuring out the technical parts of the digital health passport were relatively easy, compared with making sure the app would be used along each step of the travel process.
What's hard is the coordinated process, starting with a laboratory in a different country, creating a foreign medical record, boarding an airline, another highly regulated industry, and then crossing an immigration gantry, which itself is regulated by the rules and regulations of a country different than where you got your your health tests.
When Castañeda arrived in New York for a layover on his way to Dallas, he says airline staff didn't ask to see proof of his health status. The Rome Airport Authority said they're educating travelers about the app and plan to reach out to airlines. Despite the patchy use of the app, Castañeda says the digital health passport is a game changer.
Last time I traveled to the States was March of 2020, right before the pandemic hit. So it's nice to travel again.